Hello everyone, welcome to another video of Bovineology. Hello everyone. So last week we talked about some key changes that you can find when you're doing pregnancy diagnosis using rectal palpation. This week we're going to talk about pregnancy diagnosis using the ultrasound. And the ultrasound confers you a lot of advantages over rectal palpation. Both methods have their advantages, but today we're going to talk about some advantages that the ultrasound has over rectal palpation. And one of them is that you can do pregnancy diagnosis earlier than rectal palpation. So as I said, when you're doing rectal palpation, if you're experienced, if you are well trained, you can do it around 31, 33 days. Using the ultrasound, you can do earlier than that. You can do as early as 26, 28 days, depending on how your technique is. So it doesn't sound like it's too much. Maybe 5, 7 days that you're doing it in advance. But believe me, if you have a dairy operation or if you have a ranch that you have multiple cows, if they did not get pregnant, these 7 days add up and they sum to the number of cows that you have, and then you can potentially lose a lot of money by wasting these 5 or 7 days that you could be breeding them in advance. So the ultrasound, here I have we're going to have a lot of pictures. Again, this is Dross project. And here we have a picture of a 21-day pregnancy. We have a corpus luteum over here. And then we have here's one of the horns and it has some fluid in it. By 21 days, it's impossible basically to diagnose pregnancy using accurately in a certain using the B mode ultrasound. So as for a starter, I want to talk about the corpus luteum. You already know a corpus luteum is the corpus hemorrhagicum, is responsible for the production of progesterone. Progesterone, as we talked multiple weeks ago, is the progestational hormone, so it's necessary for maintenance of pregnancy. But what I want to point out here is that at 21 days, you cannot see an embryo, you cannot see anything. So yes, you see some fluid in the horns, you can see the corpus luteum. It might be indicative of pregnancy, but it's not but it's not a definite sign of pregnancy. Just as rectal palpation, if you feel asymmetry of the horns is an indicative of pregnancy, is not determinant that it is pregnant. So you have to look for other landmarks. At 21 days, you cannot see them. So we usually don't do ultrasounds at 21 days, right? Other things that you can, so for example, pathologies that you can see a corpus luteum and some fluids inside the horns, inside the uterus, is pyometra, right? So pyometra is the presence of pus inside the uterus. The fluid is not going to look like this, of course, and probably the horns or the uterus is going to be more distended than this, but you're going to have fluid inside the uterus and corpus luteum. So that shows you that using this as a determinant of pregnant is not good. Moving on, around 26 days, here's just a picture of twins. So this is one horn and this is another horn. So you can see the embryo, you can see another embryo over here. So this is already a definite sign of pregnancy. So this can be used. So as I said, around 21 days is when you're gonna do the ultrasound to diagnose pregnancy. So here you can see the embryo. You can see a corpus luteum here on the side. So this figure is divided in half, right? So this is one of the ovaries with a corpus luteum, and here is the embryo. And just like the rectal palpation, as time progresses, the bigger this embryo is going to become, this concept is going to become, easier it is to see, right? At this point, you can already see heartbeat. Unfortunately, by the pictures, we're not going to be able to see the heartbeat. But if you have recordings, you can actually see the heartbeat of the embryo. And embryo heartbeat is very fast. So do not, if you look at the embryo, you're going to see that it's very fast. So you should not be concerned. Usually you get concerned when the heartbeat is low, then you're concerned. So this is another picture. So this is actually 1 day after. This is a 29-day pregnancy, and we can see how the embryo takes form. And again, as we progress, we're going to see how the embryo takes, the conceptus takes shape. I want to move forward a little bit more so you guys, so the video doesn't extend too much, but you can already see here around 31, the conceptus here. Here's same around 33. Here you go. So around 38, you can already see shapes more clearly. So here's another cross section of the same conceptus. And I want to go forward a little bit more, and I want to show you. So this is the spine of the fetus. So as we progress, we can see very nicely, very, very clearly how the conceptus forms. And here's another picture, probably from the top, right? There you go. So these are some nice things about the ultrasound, that you can actually see the conceptus, you can see the fetus, you can see heartbeats, you can see all these things that the rectal palpation does not allow you to do, right? And then, so another view of the fetus. Another thing that you can do with ultrasound that the rectal palpation does not allow you to do is fetal sexing. So by looking at some tubercles in the gonads, let's say, you can say if it's a male or female. I'm not going to start this topic. This can be a topic. This can be the topic for another video. But I want to just stop here with the ultrasound. As I said, I don't want to go to. I don't want to extend this for too long. This video, I don't want the video to be for too long. And I'm not going to go up to 200 days. This website has ultrasonography for up to 200 days. So you can actually go to the website and look at them. But the reason why I'm not going all the way is because the main reasons you do the ultrasound, as I said, is for early pregnancy diagnosis and you check for fetal health, right? So I hope you guys enjoy. Please, if you like, share, subscribe. Let's get this information. Let's spread this information to all the people that need, and I'll see you in the next video.